it's me. I just wanted to do a little update because it has definitely been a while. I had every intention of documenting this process, which I did through some photos, but when it came down to it, I honestly just wasn't really feeling up to it. I wanted to record myself giving myself injections or somebody else giving me injections and kind of go day by day, saying how I felt and what was going on, but I really just wasn't feeling well, and I wasn't taking the injections like I thought I would. So the video that I posted of my nurse Courtney doing an injection was the very first injection that I had, and it was probably one of the better ones. So even though I pulled away and kind of freaked out and kept covering my stomach, it went relatively well because it was, let's say, under 30 minutes. After that, the following 3 injections I did myself. So the first one that I did was later that evening, that same day, and it really did not go well at all. So that was this medication here, Minipure, and it comes with a powder and a liquid, and it comes with a big, huge mixing needle, which is, this is so dangerous, which is this bad boy right here. And I got all ready to do the injection and started sort of getting everything together. And I was already feeling a little stressed because you do just a quick instruction of your medication. So we literally sat through a 20-minute thing with Courtney where she told us how to do each injection, and there's a number of injections. So when it came down to it, I was like, oh my gosh, I should have taken notes. I can't remember exactly how to do things, and John was trying to tell me how to do it, and I was getting frustrated because I didn't really feel like he knew. So anyways, I started mixing the injection myself, and then this needle comes off of the syringe, which is this syringe here. It comes off, and then the actual needle that I use for the injection, which is this one, pretty small, not too bad. I mean, not super small, but not too bad. Anyways, this one goes on. So what happened was that I went to pull this large needle off, and I didn't have the cap on all the way, so I pulled it like this, and then I ended up jamming it right back into my thumb under my nail. So that was sort of the tone that was set for me doing the injections myself. I instantly started bawling. There was blood. I like to say there's blood everywhere, but it really wasn't that bad, but it was very painful because of where it went in. And I believe I started the process at 7, and had every intention of doing it, I think, at 7 or 7:30, but I literally sat like this for about an hour. It was really bad, you guys, and John kept telling me, just set the needle on your stomach and then just push, and it doesn't hurt. The needle does not hurt going in, but it's so much more to me than that. It's really just all about the needle, not really the pain. So I had a lot of little spots on my stomach where I'd 1, 2, 3 and couldn't do it, but poked, and so then it bled. So it was just kind of a disaster. Anyways, before the time was up, I had actually just kept poking and prodding around, and I was like, oh, it's in. And so then I was able to like put the medication in, and that hurt really bad. That really stung. The Medipure is not really easy. It was actually the worst medication out of all of them. So that was night one. The next morning, and I literally cried throughout this whole time, the whole hour, saying like, how am I going to be able to do this? I'm not going to be able to do this. Like, this is too much. Like, I'm not strong enough to go through this. Everyone said it was easy. Why can't I do it? So it was really like a tough thing for me. So the next morning went a little bit better. There were no tears, but it did take me about 30 minutes. And so my first injection went in around 8, and they're all supposed to go in at the same time. My morning injection, so like 12 hours apart. So we decided like 8 and 8. So the next morning I had to do my injection at 8. So I think I started at like 7:30, and then finally it was kind of like the same thing. And the morning one's a lot easier because it's the gonal F, and it has to be refrigerated, but it's like in this little EpiPen. So like you do your dosage, which mine was like 150, and once you have your dosage correct, then you take this off and your needle is on there, and it was the same needle that I showed you, and then you just inject it into your stomach. This one it stung a little bit, but it really wasn't bad. So this one was a lot easier, especially because there's no mixing involved. So it took me about 30 minutes to do this that morning, and I didn't cry, but it's still like, I mean, I was up early, I was thinking about it, I was counting down, so it just wasn't fun for me at all. That evening was kind of like the end all of everything. So we had concert tickets for the Lumineers in Berkeley, and I knew that we were going to have to take the injection with us. So the same injection, the night injection, which is Menopur. And I was trying to figure out like where we were going to do it, how we were going to do it. So we ended up going to dinner, and then I knew that we had to do it before we went into the concert. So we found a parking spot, and it just so happened to be on a very busy street at the college. In fact, it was like right in front of a fraternity, so people were walking by the entire time, which was really stressful because it pretty much looks like I'm shooting up drugs. And so we didn't want anybody to think anything. And my intention was to do it quickly, but that didn't happen. So we had it all mixed, and just like every other time, I count down 1, 2, 3, and then I can't do it. And then I kind of start to panic and stress out a lot. And then I start to get emotional, and things start going through my head, like I can't do this, or I don't want to do this anymore, or I'm not strong enough for this, or why is everyone able to do it so easily? And it was so difficult for me. So I kind of did the same thing again, like tapped around on my stomach, which made little blood marks everywhere, but like I said, it doesn't really hurt, so it has nothing to do with that. But I think that I put it in at like a 90-degree angle, or the needle was already like, I don't know, like not sharp anymore because I had tapped it onto me so much. But what happened was that I got it in about halfway, and I couldn't, I literally thought I was pushing, but John said I was not pushing it in. But I could not get the needle to go in any further, and it has to go in all the way before you can inject the medication. So I'm like sitting there like trying to push it in, and then I told John like, oh, I don't feel good, because I've passed out plenty of times before when it comes to needles, so I kind of knew it was coming. So I ended up pulling the needle out, and immediately it was like dripping sweat, like face white, super hot. And so I was like, I have to get out of the car. And so, like I said, there was people everywhere walking all along the street. So I get out of the Jeep, and I'm like taking my sweater off, and I had to sit down on the curb because I thought I was going to fall, and like everything was like getting like this, like dark, 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 dark. And so I'm sitting down, and then like I start to come out of it a little bit and realize that, Marianne, there's people walking, and they're walking around you, and they're walking around you because you're on the ground passing out. So I was like, I gotta get back in the car. So I get back in the car, and I'm still really not feeling well, and I'm telling John, like, I'm not feeling well. He's like, get in the car, we're going to the hospital. And I'm like, no, like nothing's wrong, but like I'm passing out, you know? And so anyways, I said, I don't feel good. I think I'm going to throw up. And I literally opened the door and like yacked all over the ground in front of, I don't even know how many people. But that was pretty much the worst night for me. And that was actually also the very last time that I did my own injection. Not because like John was irritated, which he probably was, but I just knew that I couldn't do it anymore myself, and that it would be much easier. And actually everyone on Instagram was like, it's so much easier if someone else does it for you. But before I was like, no way, I'm not letting John do this. And so finally I just like let go of the control and was like, okay, I can't do this myself. So anyways, it was kind of like the first couple of times I finally just dabbed again, and it went in, and then I was able to inject the medication, and we went to the concert, and it was fine. So, like I said, that was the very last time I did that injection. The next morning was very traumatic just because of the night before. I was already super emotional, terrified. Like I literally did not want to do it anymore. Like I did not want to do IVF anymore. I didn't want to do any of the injections. Alicia had to come out and like hold my hand, and I was like bawling like a 2-year-old, and it took about 5 minutes, but we did it quickly. John did an awesome job, and he did a really great job actually after that for the rest of the time. So that was kind of how my injections went. The medication wasn't bad at all. I didn't really feel like it had too many side effects. In the very beginning, I had a little bit of a headache, but that was about it. I wasn't moody. I wasn't really emotional until the end of it. But all in all, it went well. So I did the first injection, Gonal F, in the morning, and then the Menopur at night, which that injection was just awful. And then on day 4, I added a new injection, which is this here. Ganirelix, and it was actually the best injection that there was. I literally didn't feel the needle going in, nor did I feel the medication. So it was my favorite, I guess, except it left bruises all over my stomach, which was kind of nasty. The only other side effect was the fact that your stomach gets so bloated. Your ovaries are usually the size of an almond or an almond, however you would say it. And when you're going through IVF, they are the size of a lemon. So it's pretty painful. You just feel very bloated and achy. And by my egg retrieval was on Sunday. So by Sunday morning, I literally walked like I was probably 9 months pregnant, and very, very slowly because every footstep hurt really badly. So my egg retrieval was on Sunday. We had to be in Roseville by 7:30 for the surgical prep, and then the egg retrieval was at 8:30. The egg retrieval was quite different than I imagined it. The surgery is nothing. I mean, it's nothing like going in for like a major surgery. But I didn't really expect to feel the way that I did leading up to it. So like probably the day before and the day of, And then for sure, the way I felt after was not what I expected at all. I felt really, really, really sick and bad and really uncomfortable and in pain. And I didn't really realize that I was going to feel that way. So that was kind of a shocker to me. The retrieval went well, though. When we went in the day before on Saturday, they told us that I had 32 follicles, which is a really great number. But they said that at that point, I only had 17 mature. So I had 17 that were like the correct size. So although we thought they were going to take all 32 out, we did end up only having 17. So they did take 17, and we're like, oh, that's great, 17 mature follicles. But then we got a phone call the next morning. So they call you throughout this process to update you on how your embryos are doing. And we received a phone call on Monday morning, and I was kind of bummed about it. So they called and said that 15 of the follicles were actually mature, not 17, which I don't really understand. So I guess that's something that I still need to ask about. But when you get a phone call like this, you're kind of just like listening, like in shock a bit, I guess. And so we had, out of those 15, only 9 fertilized. And I think that was the biggest shocker to us, because we had paid for ICSI, which is for them to actually put the sperm inside the egg. And so I think we just thought like they would all fertilize. 1 did fertilize abnormally, and then 5 did not fertilize at all. And like I said, when you get this phone call, like at least for me, I was just kind of in shock and just sort of listening. So I didn't really ask too many questions at all. So there's still quite a few questions that I need to ask about that. So they call you the day after your egg retrieval, and then they also call you 5 days later. So between day 1, which is the day after, and then day 5, you typically end up losing quite a few embryos. They have to multiply their cells to make it to day 5, and if they don't, then they die off. So tomorrow's a really big day for us. Super nervous, super anxious, already kind of losing sleep. I was really emotional on Monday because I wasn't really expecting that, and I felt so awful from the egg retrieval. And I was just thinking, like, we did not just pay for this and go through all of this for it to not work out. But the reality is that for some reason, John and I cannot get pregnant on our own. So when I stop and I think about that, I realize that obviously there's going to be some kind of issue, because IVF is not a 100% guaranteed thing. I knew that, and I know that, but when you go through this process, you kind of just trust in the process, and you trust that it's going to happen. But we don't know. We don't know if it's going to work, and we don't know if, we're actually going to be able to have our own baby. We're just trying to have as much faith as we can right now and hope that we get a really great phone call tomorrow. So they could call and say this many embryos made it, which means that they will freeze those. And if there's still some that look like they're hanging on, then they'll give them one more day to see if they make it. If they make it, then those will be frozen. If not, then we're just left with however many made it to that day 5. We are not doing a 5-day transfer, so we're not transferring tomorrow because we're doing genetic testing. So a few cells from each of our embryos will be sent out on day 5, and they'll be tested. So we're doing a frozen embryo transfer. and we actually don't really know when, because they're making me go through a rest cycle, which I think that they typically make some people do, but also because I was overstimulated a little bit, they want my ovaries to sort of have a break. They said that if I would have done a transfer on day 5, that my chances of having OHSS were really high, and that can typically land you in the hospital. And I'm so glad that I'm starting to feel much better, because it just really, I didn't expect to feel as bad as I did, and it kind of gets you down. On Monday, when we got the phone call, I was really upset, and I think John was really upset too, and he was kind of shocked. Like, we both didn't really know what that meant. And if you read into IVF, there are good stories, but a lot of people that do writing on boards and stuff, they're writing because they have a difficult story, and they're trying to find answers. So a lot of times people will not even have embryos that make it, or possibly only have like 1 or 2, and then they transfer those 2 and they don't end up pregnant. So I think at one point John asked me, like, well, what would be our next step if this didn't happen for us? And I literally like was bawling, thinking like, what do you mean our next step? Like, this was our next step, like this was the final step. And I hadn't thought past IVF really ever. We have talked about adoption, but we kind of figured that we would have a child of our own, I guess, and then maybe think about adoption. So that was kind of an eye-opener, and I think that the way I felt at the time, because I was feeling so awful, I was thinking to myself, like, there's no way I could go through this again. I'm never going through this again. Like, the egg retrieval and the way that I felt after was worse than all of the injections put together. So, and I don't mean to scare anybody by saying that if you're going through this. I think that everybody responds differently. And I wasn't like throwing up or anything, but I was just so uncomfortable that it just makes you feel really crummy. So getting back to the transfer, they wanted my body to go through a rest period. So that is from the end of October through November, I believe, or maybe the beginning of November, kind of depending on when I start my cycle. Sometimes all of the medication can kind of throw your body off. So whenever I start my cycle, from the first day until I end my cycle, that would be the rest period. And then I would have to wait for that cycle to finish, and then kind of like get back to like when I would be ovulating. They want us to do a non-medicated transfer, which I'm excited about. A little nervous because I know that most people do a medicated transfer, but you do the progesterone and oil, and it is with this needle here. So, and it's something that you do until you're in week 11 of your pregnancy, and it goes like in the top of your booty. I honestly, even if they were like, Marianne, you have to do a medicated cycle, you guys, I don't think I could do it. You don't even understand how terrified I am of needles, and there's just no way. Like, it wouldn't be possible. So, I have an amazing nurse, and when we were doing the HCG shot, I think that you do it in a kind of a large needle like this because it has to go into your muscle. And she worked it out so that I could use a smaller needle. I didn't end up having to do the HCG shot. I did a different trigger, but because I had so many follicles and my estrogen levels were so high, and they were worried about me overstimulating, so they didn't have me do any of the HCG. I just ended up donating that to our clinic. But so they want me to do a non-medicated transfer, which means I would just do progesterone suppositories and I think possibly a progesterone cream, and then some other things like just like the regular vitamins. So I do prenatal 3 CoQ10s a day, 3 fish oils a day, 2 Tums for extra calcium, 2 vitamin Ds, and a baby aspirin. I think that's everything. So I'll take those as I usually do, and then the progesterone, and then they kind of have to check my levels to make sure that my lining is thick enough and my estrogen and progesterone levels are high enough to be able to actually get pregnant. So as long as my body matches up with the transfer, then they'll do it. But chances are I could actually go in for the transfer and they could say, oh, like things don't look good, like we have to cancel this cycle. But because we don't really know when we're going to do it, we're not like super set on anything. We're kind of set on December, but the office actually has a closure towards the end of December, and if my ovulation falls within that time, then we won't be able to do it then. So things are kind of up in the air right now. December, possibly January, we just don't know. But I will definitely keep you guys updated now that I'm feeling better. Like I said, tomorrow is a really big day, so I'm hoping for the best, and Saturday is another big day, so if we don't have enough embryos by tomorrow, hopefully Saturday will be even better, and then a week or two from then, we will get all of our genetic testing back, so that's actually another big day also. So anyways, stay tuned.